Africa's vulnerability to the disruption of international supply chains during the COVID-19 pandemic has hit hard, with 2/3 of African countries being net importers of food and medicine. Global trade restrictions and cross-border blockages are reported to have created shortages. The AfCFTA is now looking into the possibility of producing vaccines to help the continent cope with future pandemics.
What we are looking the AfCFTA to do is to provide the legal framework for the production of vaccines, the legal framework for the production of, not only for this pandemic, but for other pandemics, as well as the legal framework for the establishment of a generic drug industry. This is what we've learned from this crisis, this public health crisis.
According to the AfCFTA Secretary General, fundamental progress has been made in trade promotion despite the impacts of COVID-19.
We have made progress in establishing the legal frameworks that are required in order to enable commercially meaningful trade. We have also established an adjustment fund, an initial amount of $1 billion, which will enable us to make sure that countries that need the support as they experience short-term revenue losses, that they have the support to offset those losses.
As African countries focus on managing the health crisis, the immediate need remains finalizing the AfCFTA agreement. So far, 40 African countries have ratified the African Continental Free Trade Area Agreement, with the recent ratification of Tanzania. Daniel Arapmoi, CGTN, Nairobi, Kenya.